All right. Hi there, everyone. Let's see. I'm Rundy Murphy. I'm epidemiologist and the director of disease surveillance at the Mobile County Health Department. Today is the 19th of July. Just check that. We had. How's that, Mark? Is that better? Sorry, we're adjusting volume here a little bit. Is it okay to proceed? Okay. 1 minute. Can you hear me now? Okay, we lost lights too, Mark.
Oh,
So how's the volume now, Mark?
we've lost internet too.
Oh, because of the storm. All right, I think we're going to try it without the lights, but with volume. All right, so hi. Let's get this started again. There we go. Okay. Apologies, everyone. I'll start over. So hi, I'm epidemiologist and director of disease surveillance at the Mobile County Health Department. My name is Rundy Murphy. I'm here on Monday, July 19th to give you a Facebook Live update on the impact of the COVID-19 pandemic on Mobile County. Right now what we're experiencing is an alarming increase in infections in unvaccinated people. So we really have a COVID pandemic in unvaccinated people, and it is greatly driving up the number of COVID infections and hospitalizations in Mobile County. So this week in our weekly expanded report, we're reporting a total of 43,848 COVID-19 infections and 856 COVID deaths. So let me just read you some key indicators. And again, just to remind you, it's not too late to get vaccinated. You could be protected within 3 weeks if you take a J&J vaccine, and you could be protected within just 5 weeks if you take a Pfizer vaccine. That would be just in time for school start for those of you who are still in school and at least 12 years old, eligible to get that Pfizer vaccine. So here's what's happening around the county with regard to COVID-19. So if we look at just the 2 weeks that have gone by since July 4th, so if we compare the 14 days since July 4th to the 2 weeks prior to July 4th, this is what's been going on in our county. The number of cases have more than doubled since July 4th. In fact, the number of cases that we've seen just through yesterday in July exceeds the monthly total number since February. So this, just in the 18 days that we have data for July, we've already exceeded the monthly number of cases for March, April, May, and June. So infections are accelerating in all age groups, but there are more infections in the 18 to 49 age groups than any of the other age groups combined. So more than half of the cases that we know about are occurring in that largely unvaccinated group of people who are 18 to 49. Now remember, I mentioned that the rates are going up in all age groups, but the highest age-adjusted rate of infection is in, again, 5 times more people aged 18 to 24 got COVID in the last 2 weeks, and alarmingly, 5 times as many people who are 0 to 4 years old were reported to us as having acute COVID infections. So again, just really high rates of COVID, accelerated number of cases, high transmission of the Delta variant in unvaccinated residents of Mobile County. In addition to cases, we've seen the percent of emergency department visits that are for COVID-like illness double. since July 4th. Also, the percent of COVID positive laboratory tests nearly tripled in the 14 days since July 4th. So we went to just under 5% prior to July 4th to last week a 14% positive COVID tests. And luckily, we are seeing the number of tests performed going up. It's really, really important that anyone who's having symptoms of COVID, who's been exposed to COVID, who has traveled, please go out and get a COVID test. You can get one all over town, and we provide free tests at 2 locations 5 days a week. So I mentioned hospitalizations. So just to give you some framework, yesterday there were 62 people in the hospital with COVID-19, and that is the largest number of people hospitalized on a given day since March 8th. And our lowest number of hospitalizations this year was just 15 people in the hospital on June 20. So again, just 1 month ago, we had only 15 people in the hospital, and yesterday we had 62 people in the hospital, a quadrupling of people hospitalized. I think the one piece of information that is good, but we're keeping a close eye on it, is the number of deaths that have been reported. Right now, that number is low and attributed to high vaccination rates in older populations and people with underlying medical conditions. However, most of the people hospitalized with COVID, those people who are unvaccinated and that, have severe complications requiring hospitalization, they're also in the older age groups. So generally we see deaths lag about 10 to 14 days behind hospitalizations. So we'll keep a close eye on that to see if the deaths from COVID inch up or if they stay really low. So again, everything COVID infection, hospitalizations, emergency department visits, percent test positive, all moving in the wrong direction, all going up at an incredibly fast rate due to that Delta variant and the very low vaccination coverage that we have in Mobile County. So I have just a few comments. People are always asking me about breakthrough infections. Yes, we know that breakthrough infections occur because no vaccine. These vaccines are not 100% effective. We expect that there's going to be COVID infection in people who are fully vaccinated. That is fully expected. And again, some people, when they get vaccinated, maybe they have immunocompromising conditions or underlying health conditions that that limit the amount of immunity that they build from getting vaccinated, and they are subject, more susceptible to infection even though they have been vaccinated. The other thing that we see a lot of, and I think I don't get as many questions about this from the press, but I think maybe we should, is that we see many more reinfections, or we're able to document many more reinfections than we see people vaccinated getting COVID. So it is not true that if you have previously been infected with COVID, if you previously had COVID, that you are protected. That is not true. You will have some natural immunity for a couple of months, but it does not protect you from reinfection, and it also does not protect you against severe complications and death to the same measure that vaccination immunity brings. So just want to remind folks about that. I'm told by the Alabama Department of Public Health that they are preparing a dashboard to provide the information, some of the information on breakthrough cases or reinfections and maybe variants soon. But right now, those county level information or statewide level on breakthroughs, reinfections, and variants have not been made publicly available. So we will not be able to share that with you until they do. A question came in about schools. Should school leaders be concerned about having in-person classes in the fall without a mask mandate and not everyone vaccinated? So yes, CDC has come out with new guidance for K through 12 schools believe it was released on July 9th if you want to go out there and look for it. And what it says is that we want kids back in school, right? Parents want kids back in school, teachers want to be back in school. But what they have made very clear is that anyone who's in a K through 12 indoor setting that is not vaccinated, they should mask and distance. So CDC is very clear on this, that it is highly recommended, strongly recommended that anyone, a student or a teacher or staff member or workers, contractors, anyone in a K through 12 setting that is not vaccinated should wear a mask and distance to the greatest extent possible. So we will continue to support those recommendations in all schools. And again, if you're outdoors, if you're fully vaccinated, then there's no need to wear a mask in those situations. Also, if you are fully vaccinated, if you are exposed to someone with COVID, then you don't have to quarantine. But everyone else, for everybody who is unvaccinated or is beyond 90 days past a COVID positive test, if you test positive for COVID, you must isolate at home for 10 days. If you are not fully vaccinated and you are not within 90 days of having a COVID positive, if you are exposed to someone with COVID-19, you must quarantine for at least 10 days with 14 days preferred. There seems to be some confusion out there that maybe quarantine and isolation don't apply anymore with the expiration of the Safer Apart order and the expiration of the state of emergency. But that is not true. Alabama Department of Public Health guidance and CDC guidance is still very clear on this. If you have COVID or symptoms of COVID, you must isolate for 10 days. If you are not vaccinated or within 90 days of a COVID positive test, if you are exposed to COVID, then you must quarantine for at least 10 days and 14 days are preferred. All right. Let's see, someone has a question. Does it really make sense for vaccinated people to not quarantine since they have been shown to be silent carriers? So this is a little tricky. I think what this is getting at is that, I think about 2/3 of people who have been fully vaccinated but get COVID, about 2/3 of them don't have any symptoms, because again, that immunity that comes with vaccination, even if they do get infected, they're going to have a very mild illness, hopefully a very mild illness. And so they may not be showing symptoms of COVID, may not know to stay at home. So this is a little tricky. So what we'd like to do is continue to promote vaccination by recognizing that, being fully vaccinated gives you the very best chance of protecting yourself and protecting others should you get reinfected. You'll have a lower viremia, not as much virus in your system, and you'll be either asymptomatic or have a easier course of illness. But yes, we do recognize that some people who are vaccinated, if they get reinfected, they may not realize it and may be at risk of vaccinating others. So a lot of public health leaders are coming out and saying, if you're in an indoor setting, or particularly if you are in a gathering where the vaccination status of people is unknown to you, then you might think about adding an extra layer to being fully vaccinated by wearing a mask or maybe distancing, that sort of thing. When you're in large groups, particularly indoors, when you don't know if there is, what the vaccination status is for everyone. Okay, I'm trying to look at the screen and see if there's another question. Yeah, so you're right. Someone is asking, kind of, I think maybe surprised that we're working on the honor system, right? We have been working on the honor system for most of the COVID outbreak. So people who are fully vaccinated don't have to wear a mask, outdoors or indoors, but we have to rely on the honor system. So, we're hoping that people will do the right thing, and if they are not vaccinated, that they will wear a mask if they're indoors. But we Right now, there's no such thing as an immunity passport. People are not being asked to document vaccination. So it is a little tricky when we are relying on people's honesty and morality and ethics to do the right thing. So, you know, help out Mobilians and do your part to try to slow transmission. Let's see. All right. So some questions are just coming in, really about sort of getting at this idea that the only way we're going to be able to slow the COVID outbreak is if we all work together to do our part. So we can't just have 30% of the population getting vaccinated and think that we're going to slow the outbreak. We're not. If we stay at 30% vaccination, this outbreak is going to go on and on and on. We have to have more barriers to transmission. So whether your barrier is getting vaccinated or wearing a mask or social distancing, we have to break the chain of transmission in order to curb the outbreak. At our current vaccination levels, I fear that we're going to see more and more and more transmission, and we are going to be dealing with this for many, many, many more months or years to come. So what we at the health department are asking everyone to do is do your part. And if you don't, if I've not convinced you over the past 18 months, please talk to your friends, talk to your family, talk to your pharmacist, your doctor, your dentist. You know, call someone else that you trust, maybe a grandparent or an aunt or an uncle. Just have the conversation. And just remember that if you don't want to get vaccinated, wear a mask. If you can't tolerate a mask, socially distance, right? If you can't socially distance, you know, at home, go to smaller, you know, crowds with smaller events. Try to do all of the things that we know have gotten this outbreak under control at times as we go into the fall with no stay-at-home order, no masking order, very small number of people in the county vaccinated. You know, return to in-person instruction in K through 12 and institutes of higher learning with no mask mandates. All of these things are putting us in a really risky situation going into late summer and fall. So there are things that everyone can do, and we're only going to be able to turn it around if we work together. So there's a question about the percent of hospital beds that are currently in use. We have plenty of hospital beds, plenty of ICU beds, ventilators, all of those things. Right now we're good. We're hearing from some of the hospitals that staffing continues to be an issue. It's different. The reason for staffing issues is a little bit different right now than it was, say, last year this time. In that a lot of parents are not able to come to work because their kids are at home with either COVID or RSV. You know, we didn't see an RSV season last fall when we normally see flu season and childhood viral respiratory infections circulating. That didn't happen until later in the spring when the mask mandate was lifted. Then we started seeing all those childhood respiratory viruses, and now we're seeing some of those things continuing in children and spilling over into adults, either, you know, getting it or having to stay at home to help care for their children. Okay, so let me just remind you how easy it is to get vaccinated in Mobile County. What we are going to do, people ask us all the time, you know, how are you going to change the conversation around COVID vaccine? What are you going to do to try to get people vaccinated? And what we're going to do is try to stay the course and remind everyone that the threat of COVID infection is high in the unvaccinated population. We have a very safe and effective vaccine that can protect you within, give you full protection within 3 to 5 weeks, which is a very short amount of time, still in time for school. And what we're going to do is just continue making it as easy for you to get a vaccine as possible. So we are still running free walk-in vaccine clinics at 2 locations, at our downtown Keeler location and at our New Bern location on Cox Street, where you can get a JJ, Pfizer, or Moderna vaccine or a COVID test free walk-in, no appointment necessary, Monday through Friday, 9 to 3:30. And then we are going to continue doing our community vaccine events. You know, when we were at the cruise terminal, we did over 20 days of clinics at that cruise terminal. And since we left the cruise terminal and changed our model of doing more community-based vaccine events, we've clocked 127 community-based events around trying to get the vaccine out to where people can, you know, get it very conveniently. So, like for example, this week we'll be at Bishop State, at the Strickland Youth Center, the Biola Battery Community Center, Hank Aaron Stadium, Bay Bites Food Truck Festival at Cooper Riverside Park. Every Thursday, we're at the Occupational Health Center on Michigan. Going back to Doctor's Barbershop on DIP to give second vaccines and first doses there for anybody who wants it. We'll also have a Saturday event on DIP at the American Legion Post 250. So again, we're like all over the place. Flea markets, truck stops, churches. I don't think we've done a yard sale yet, but who knows? We've gone into people's homes who can't get out. We've boarded vessels to get people vaccinated. So we're going to stay the course and keep recommending that anyone who's eligible, anyone 12 and over, get vaccinated for COVID. We are looking for locations to have vaccine events in the western part of the county. So if you have ideas about vaccine locations where we could have an indoor vaccine clinic in Grand Bay, Dawes, or Sims, or Wilmer, please let us know. So Grand Bay, Dawes, and Wilmer, if you know of places there that you could partner with us to help us have an indoor vaccine clinic either during the day, in the evening, or on the weekend, please let us know on Facebook. And I think that is all, Mark. Oh, and don't forget, testing every day. Testing is one of those layers of prevention measures that are going to be really, really important. With so much COVID transmission going around, we need people to continue to get tested so that we can identify people who are spreading COVID, who are, you know, infectious with COVID, and get them home so that they won't keep spreading COVID around. Let's see.
Hang on.
Mark's going to go back through some of the questions since maybe we have a little bit of time and we haven't been on Facebook Live for a while to see. So there's a question. So there's a question about daycare workers where people are working that they're not vaccinated. So, you know, because the vaccines are being used under emergency use authorization, we're really not, businesses, agencies, schools, daycares, hospitals, nursing homes really are not able to require that their employees get vaccinated. Hopefully, when FDA gives full FDA approval, of the 3 products that are being used in the United States, perhaps some, you know, businesses or facilities or agencies will change their approach to that. But again, it will be up to each individual institution or agency or workplace to make that decision for themselves, for their workers, and for their clients. Let's see. Wearing a mask, and I'm the only one in the store wearing one. Does it help protect me to COVID? So honestly, if that's the situation, you're doing more to protect them than protect yourself, but it doesn't hurt, and it adds another layer. Somebody asking about the vaccine doesn't help against new COVID that's out. That is not true. So there is plenty of information out that the current vaccines that we have are effective against the Delta variant. So any contrary information to that is not factual. Information on when children will be under 12 will be eligible for the vaccine. So I asked CDC that question earlier today, and they have said perhaps by the 4th quarter of the year, possibly not until the 1st quarter of 2022. And that's it. Okay. All right. Mark says that I can stop answering questions. All right. So thank you all. We're going to keep a close eye on how things are going this week. If we think we need to jump back on and provide some sound bites or answer some more questions, we will do that perhaps on Thursday. So stay tuned to our social media outlets and we'll let you know if we decide to do that. So stay safe out there. Remember, if you are not vaccinated, please protect yourself. It is really bad out there right now. We have high levels of transmission everywhere. So please protect yourself by getting vaccinated. And if you cannot or will not get vaccinated, please wear a mask and distance yourself when you're indoors. Thank you and have a great week, everyone.